Good afternoon, everyone. Thank you for joining Encore Palm Beach County for our monthly Zoom call. We have a special event today, the Looming Crisis in Healthcare Staffing. And to introduce our esteemed panel, I'd like to bring on our founder, Rosemary Nixon. Rosemary?
Thank you, Christine, and good afternoon to everybody on the call. Thank you for being here. As Christine said, the topic today is, do we have a crisis in healthcare staffing? And our guests are Kato, who is the Chief HR Officer of Broward Health, Coral Springs, and President of Palm Beach County SHRM. John Dalton, who's President and CEO of Optimum RTS, a staffing agency with a specialty in medical staffing, and the 2022 winner of the Wisdom and Experience Award as an age-friendly employer. And Tamara Lane, Area Vice President with Gallagher, an insurance brokerage, risk management, and HR consulting firm. Do I have everybody's titles correct? Okay. Yes. These are very experienced people who have substantial experience in various areas of the healthcare industry. So with regard to today's topic, do we have a crisis in healthcare staffing? Would you each share your perspective on the topic, both in the U.S. generally and in Palm Beach County particularly? Katie, would you go first, please?
All right. Well, thank you so much for the opportunity to join the panel today and to be a part of this discussion. I do feel, of course, that we do have a crisis in healthcare staffing. I don't know that I would call the crisis new, because healthcare staffing has been a challenge for as many years as I can remember, and I've done healthcare human resources for well over 30 years. But certainly the pandemic has exacerbated the issue and made it more challenging. I also think the changes in our generational differences and work approaches for the newer generation, the emerging professionals, their priorities are different, and they have a different need to work as many long, crazy hours that the baby boomers like me would be willing to work. So I think that, it's made it more challenging to fill the healthcare staffing needs when there was already a challenge to begin with. That would be my kind of global answer. Yes, there is a crisis.
Okay. And is it more pronounced in Palm Beach County, do you think, than generally speaking, because of our tend to have an older population with maybe medical health issues?
I don't know that I would say Palm Beach County is worse than the rest of the country. I think that we're actually quite fortunate to have a lot of talent and a lot of resources. And but I would say it's just as challenging here because there is greater expanded healthcare needs because of our aged population in Palm Beach County. So I'm not seeing any Palm Beach specific challenges that I would say are unique to our area, but I do feel it's a big issue regardless.
Okay, thank you. How about you, Tamara? What's your point of view?
Sure. So I would first say thank you. I feel extremely fortunate to be part of this panelist with such esteemed fellow panelists. So John and Katie, wonderful to be able to share my insight along with yours. So I certainly appreciate that. And what I would say is that we are in an ever-changing world. And because we are in an ever-changing world, that brings about a certain amount of chaos, right? And when you're looking at the healthcare world across the nation, we are, I would agree with Katie wholeheartedly. This isn't a new crisis. We have been looking at and forging for workforce and for healthcare professionals for a long time. This has not just been, a recent thing. I would also add that because we have the onset of the pandemic, that has added additional crisis into an already, troubling workforce and ability to attract and retain just the workforce that you need to be able to do what you need to do. Add to the fact that healthcare in and of itself has a unlimited amount of demand and a very limited supply to be able to provide those services. So we have like a trifecta situation going on in healthcare. And I think that, Palm Beach County, we've had a lot of new people that have moved into Palm Beach County. I think that we have not seen the additional workforce to be able to support the additional influx of people that have moved, not just to Palm Beach County, but to Florida. We know it's a great place to live. And so we add in all those different challenges. And yeah, we've got a crisis on our hands.
Okay. Well, John, let's hear from you.
Sure. So thank you, Rosemary and Karen and everybody else for asking me to be part of this esteemed panel. I'm just very, very proud to be associated with Encore very, very much. When I look at my career and I go back to 1991, that's when I started in healthcare recruiting and healthcare staffing. During that time, we saw a lot of nurses actually coming in from the Philippines and the Pacific Islands. And that was something that we really looked at to fill that nursing shortage at that time. I think we're going to talk about it in a little while. Right now, here in Palm Beach County, I think we're very, very fortunate, actually. For our seniors, for our residents, we have a tremendous healthcare community that offers lots and lots of choices for our general population, whereas in a more rural setting, you might only have one primary care physician or very limited opportunities to go to a medical provider. Did COVID affect our staff inside the healthcare arena? Well, yes, it did. I take a little bit of a different path, however, when I talk about COVID and I think about the staff and how it changed during that time. If you go back to 2014, 2015, when I was just opening up Optimum RTS, one of the buzzwords that we always heard was the gig economy, the gig economy, the gig economy is coming. When COVID hit, however, that's when the gig economy really took hold. And it taught a lot of our healthcare employees how to cobble together their salary and the money they needed. It wasn't that the government was giving out so much money. It wasn't everybody was just sitting on their couch getting lazy. What it was that all of a sudden jobs were lost, unemployment wasn't paying the bills. So they figured out how to go out into the community and make money from different sources that equaled what they were making when they were working full time. So if you do math real quick, when you think about it, someone like a medical assistant who was making $15 an hour pre-pandemic, those now 18 to 23, but $15 pre-pandemic, that is a $600 a week salary, $487 after taxes. Put your kid in daycare for $200. Now you're at $287. You want to eat lunch for $50 a week. You're at $237. You want to put gas in your car for $50. Now you're at $187 to work 40 hours a week. Well, I can get in my car and I can go drive Uber tonight and make $187 and be with my family during the day and not have to worry about daycare or all these other things. So I think that's one of the biggest hurdles we have to get over right now. And I'm going to end my answer there because I think that's one of the key components that's causing our crisis. The seniors, myself included in that, our boomers, our Xers that are running these companies right now have a different thought process about work than our Gen Zs and millennials have. The millennials and Gen Zs are concerned with a work-life balance, and the Gen Xers like myself and boomers before had just a work ethic. We're going to work, we're going to work, we're going to work, we're going to work. And we sacrificed our family and a lot of our personal things that we might have liked to do, all in the name of going to work. And that's one of the biggest changes.
John, you touched on two things that I'd like to get back to later in our discussion.
Sure.
And one is immigration policy. I don't want to get bogged down in political stuff, but
Yeah.
I too remember when we were able to get nurses, English speaking, well-trained nurses from the Philippines. They seem to have gone somewhere else. I don't know the why of that. And I'll just mention, I have a virtual assistant who's based in the Philippines who will be converting this recording to the video for me and managing our website and so forth and so on for a lot less than I would pay a person here in Palm Beach County to do it, unfortunately for them. So the other issue, I think, is the income issue and how you can get people back working with adequate salaries so they're not running around delivering my groceries kind of thing, which, by the way, I do get my groceries delivered. Thank you very much, Publix. So, yeah, a lot going on. So, given what you see, all of us have an area of influence and a business. How do you think within your area of influence and business you can make a difference, specific things that seem possible to you? So, Katie, would you kick it off again?
Sure, I would be happy to. Everyone on the call may not be aware, this is just my third day in my new role. Getting back into the hospital world, but I've done healthcare for my whole career. And I guess I would globally have to say healthcare has been pretty aggressive in its alternate strategies to be able to find solutions, because there has been a crisis for so long. Healthcare has been forced to be very creative in coming up with solutions to encourage people to work different shifts, different times. Healthcare is a 24/7 operation. There is no rest for the weary. And as the pandemic folks learned, being deemed an essential worker bedside, there are no alternate work or remote or hybrid options for healthcare workers. So to your point with regards to what can be done now to try to address the healthcare status and within the sphere of influence that I may have, I guess one of the things that I would like to see done is to encourage the healthcare industry to continue its work in being creative with its staffing options. As I mentioned, I'm just returning to the hospital world, but it has always done different incentives, everything from shift differential incentives to registry pay, which is extra shift, and initiatives to growth and development opportunities for specialty occupations and things that they would do to try to expand the skill set of the clinicians to be able to work in other areas within the hospital. Those are things that the hospital's done well, and healthcare has done well historically. What they haven't done well, in my opinion, is I think that hospitals tend to be a little bit more rigid, mostly because it is a 24/7 operation. They're rigid with their staffing requirements to work fixed shifts, for example. So, a requirement to work 3 12-hour shifts when you may have other employees, and we'll focus on Encore's initiative with, bringing back the mature worker that may be able to provide support to the staffing structure, but not work a 12-hour shift. That may not be appealing to them. They may want to work a 4-hour shift or a 6-hour shift, for example. I think healthcare is slow to integrate those alternate staffing structures into a more rigid staffing structure. So I think that there's room to think outside the box. And I think if we don't think outside the box, we're going to end up not being competitive and not having sufficient staff to provide the patient care needs that we need. If we're only looking for 12-hour shift employees to be bedside, you're going to limit your options. So I see that there are options, there are things that we need to think of. I think remote work opportunities for your clinical staff, for example, that can do some of the support work, so clinical case management, legal nurse consulting, some of the things that can be done remotely that allow an experienced seasoned nurse to add their expertise without necessarily being bedside or in the healthcare environment are great opportunities to be able to reintegrate clinicians into the workforce. So there's a lot of things that we have to be willing as healthcare leaders to be cutting edge and be outside of the box. And we need to get outside of the more rigid corporate structure in terms of how things are mandated. That, when you work within, the corporatized healthcare environments, you have to be very consistent. There's a lot of regulatory standards. There's a lot of unionization. There's a lot of factors that force employers to be consistent, but in the same line, if you don't have the creative options that are outside the box, you're going to lose out in being able to competitively staffed to take care of your patients. So I'll leave it at that.
Katie, if I could just ask a question. How flexible are hospitals in general about recruitment of retired nurses, for example? I only ask that question because just this morning I was in the pool doing my exercises and we have a new neighbor. I have a new neighbor who just moved here from California, a retired nurse with 36 years experience, doing night work for all those years, I guess. Is she a possible somebody to help out here? I mean, I don't know her well enough to say, hey, listen, you're looking for a job. But there have to be others like her. We have a lot of new people here.
I would say yes. I'm seeing that the hospitals and the healthcare environments are creating different staffing options. So there are per diem options, there's registry options, there are travel nurse options where individuals have the ability to choose to work 1 day or 2 days. So absolutely, if a person has a license and the experience, there's a job for them to have if they're willing. The issue really is, I think the length of the shifts and the physical demands of the job are very compelling. But there's a lot of different types of bedside nursing that have varying degrees of physical demand. So absolutely, I think there's a huge market for a seasoned nurse that is willing to come in and put in, as long as they maintain their licensure and their credentials. Absolutely, there's jobs out there for them.
Katie, one of the things we do when in our effort to recognize age-friendly employers is we put their job boards on our website, particularly if they've been a nominee or a sponsor of our Wisdom and Experience event coming up. I guess that's a sales pitch there. But anyway, you might want to send us that information. Be happy to put the job boards for your employer on our website. I'm always meeting people and referring them to various employers and to review our job boards because a lot of people find, I don't think I'm saying anything that's new, the job boards like Indeed or Monster, very discouraging, particularly for people over 50. So I just suggest that for you to do that if you would be interested. So Tamara, it's now your turn.
Sure.
What do you say is possible within your sphere?
Well, let me tell you, I would echo Katie's remarks because, she has great insight into the healthcare world and some of the challenges that are being faced by our healthcare workforce. But I would also, say that it's time to critically evaluate, what you're doing with your people experience. Because we do know that Gallagher, we do have, quite a few healthcare organizations that we work with, and some of them are still lagging behind in terms of how they're operating and how they're preparing their employees, for each day. Some of the tactics that Katie had mentioned, I would also mention that that's absolutely true. We're seeing a lot of workplace flexibility, and particularly the tactics that they're using to offset some of the challenges they're having. We do a national benchmarking and strategy report. It's published every year. It's really fantastic. We actually have a healthcare addendum where we specifically target healthcare organizations to provide insight to the rest of the world about what you're doing and what they're doing in terms of the strategy. And the information, I was able to pull a couple of statistics, and Katie's right on because of the 4,000 employers that we survey, this particular addendum had over 700 healthcare organizations. And the one thing that they're doing to help offset, some of the challenges in hiring and retaining employees is they're using part-time remote working. 59% reported that. 54% did full-time remote working. 43% of healthcare respondents, they're using flex time. 29% compressed work weeks. And 11%, they're using job sharing. So there are a lot of different elements that go into addressing the flexibility that workers are looking for. And I would also add that, there's an element too of that mental health burnout. So John had mentioned all the different things that healthcare professionals are doing in the gig economy. And so because of that, there's also that element of burnout that we're seeing. And that brings another, mental health element to what our workforce are dealing with in the healthcare industry. So that would just kind of be my 2 cents worth. But there are a lot of different strategies. And the ones I mentioned, Katie even mentioned a few more that can be implemented or executed to help our workforce be a little bit more engaged and get the outcomes that we're looking for.
So, John, I know you're not a policymaker, you're not a politician, you have a business, but within your sphere of influence and your reach, what do you see as things that you could help make a difference?
It's really a loaded question, what we can do. And looking back to what Katie had said in regards to fixed shifts, I think that mindset really is something that we have to work on. So I am a national educator as well as owning my company. I speak nationally this year, I think about 11 conferences that I'm at. And part of what I'm talking about just last week at the Florida Allergy, Asthma, and Immunology Conference, talking about managing millennials and Gen Zs. So one of the things we don't realize is that Gen Zs, or the iGen, the interconnected generation, which are 24 years old and below right now, going to be the biggest wave in our workforce coming forward. And 33% worldwide of our population they have much more in common with the boomers than they really think. So you may have seen the article a few weeks back that was talking about that. And, when you think about the boomers, you think about the years, late 60s, the summer of love and free love, and everybody's against the war and doing drugs and all this other stuff. That's how we envision the 60s, like it's Hayde Park in California. But honestly, that was just a very small percentage of our population back then that made that up of the boomers. Today, with our Gen Z, we're thinking that they're just a bunch of woke kids that don't want to do anything. And again, that's just a very small percentage. What you're seeing statistically is that a Gen Z only wants 5 jobs. They want to have a job where they're going to have career growth. That was another thing that Katie had mentioned, trying to offer that career growth. So what I believe we have to do to change what's going on is to re-educate the people who are in leadership right now. When I talk to my doctor's offices or plumbing companies that I'm trying to staff, and they say, nobody wants to work full time. I need a 40-hour person. Well, why don't you hire 2 20-hour people? Right? Now I don't have to pay benefits. Now you don't have to worry about vacations, and you're getting the same 40 hours of work done out of that person. So we have to stop thinking like we were trained to think. Like the greatest generation taught the boomers, and the boomers taught the Xers. It's all about corporation. It's all about work. Sacrifice, sacrifice, sacrifice. Quick story, back in 1992, Hurricane Andrew was coming. I'm working for a large financial institution here in the area. Get a call Saturday. Everybody has to come to the bank to clean up and get the computers off the floor and make sure we're ready for the hurricane. Well, that's great, Kelly, but unfortunately, I have to go help my dad, who's 100% disabled and needs me to help him, lives by himself, needs me to help him close his house down. Well, that's great, John. You go right ahead, help your dad. After the hurricane, though, don't come back here. That was my choice. Help my dad or keep my job. So what did I do? I went into work on Sunday. Sorry, Dad, I'll get there later whenever I can. And I went to work to keep my job. The millennials and the Gen Zs are not going to do that, period. They're not going to do that. They want quality of life. They want to take care of that. Also, in retraining, the boomers and the Xers like myself see the seniors as not viable options to work, which is sad. So we have to retrain them, especially those boomers that are at the end of their career that say, hey, you know what? I do want to continue to work. So we have to re-educate them. It's not teaching an old dog new tricks. It's just helping them remember the tricks they forgot, right? When I talk to my leadership team right now, I just, the same things that made you take a job when you were 20 and quit a job when you're 20 are the same reasons that the millennials and Gen Zs are going to take and quit their job today. We've just forgotten that. We forgot what it felt like when we were 20. We forgot what it felt like when we were 30. We are living our life based off of our own expectations and not having or using the empathy of what's going on to really motivate these kids moving forward. Katie also said about that there are other opportunities for the seniors, your friend that you met in the pool. They can go and they can join a registry or they can do per diem work. That's great because my company does registry and per diem work. However, corporations don't want to hire me because it's too expensive. They would rather hire their 3 12-hour shift people. So until we're able to take those hospitals and have them begin to realize that it's better to have 3 people that are willing to work 12 hours than it is to find one that's going to work 3 shifts. Because at the end of the day, we just have to win the game. And winning the game is providing the highest level of healthcare to our Palm Beach population that we possibly can. And we just have to get there any way we possibly can. And we have to break the mold of this is how we've always baked the cake. This is how we always bake the cake. And that's the only way we can bake the cake. So it's re-education of the leadership now and the higher leadership now that I believe is going to be the change.
Thank you, John. And I have to apologize that what you do in terms of speaking to groups of people is an important part of influencing change. I just read an article today in the Harvard Business Review on this whole topic of aging, work, and so forth, all the things that we're talking about, and people changing their views. You know, people tend to get stuck in their views and stereotypes and so forth. So it's important to speak out to those groups of people where you have the opportunity to do. So I appreciate that. Everybody will try to do what they can within their workplace, but then there are people who fortunately get a platform, and I say use it.
Absolutely.
Which is actually what I'm doing. And I want to tell you, John, that I quit a corporate banking job in 1988 because I had a boss who loved to have meetings after hours, and he had no respect for people's personal time. And the last time I went to a meeting with him and I said I had to leave for an important appointment, I forget what it was. Maybe I didn't have an invalid father, but I had something that was important. And he said, "Do you really have to go?" I said, "Yes, I do." And I handed in my resignation the next day. I was 49 years old. I had no idea of what I was going to do next, but I was not going to have somebody control my personal life. So I do have empathy for younger people who do value work-life balance, something that many people in my generation never were able. By the way, I'm in that silent generation, even before the greatest generation. So I think that we need to value those points of view among younger people and be flexible. But that's just one personal little story of my own.
We all have those personal stories of our own that we've all held close to our heart and we haven't shared. And it's up to us now to start sharing the stories, because I had a banking story that sounds very similar to your story, Katie. And I bet you if we asked for a raise of hands, at least half of this room would say they have their own story that's like that too. So until we share our stories together and say, look, there is a symmetry between us all, the synergy, then that's when change actually occurs. But we all have seen the recipe on the back of the Betty Crocker cake box that says this is how you do it. And we don't ever try to deviate from that. So it's up to us to push.
Well, thank you for that. I think that's an important message that you don't hear too often. So given that we've talked, I think, enough about the way things are, so to speak, what can be done or should be done about the impact of consolidation and corporatization of healthcare practices on recruitment and retention? Because I'm just out here in the public, and I see that medical practices being bought up, hospitals being acquired, like Boca Regional being acquired by Baptist Health and so forth. As in any area of business, doesn't that affect the level of staffing when there's duplication of positions or whatever? I think that that's an area we haven't talked about. And if anybody has a perspective on that, please, because I think that's one of the areas that Karen wanted discussed for the benefit of SHRM people seeking credits.
So I will just share with you that we certainly are seeing that at Gallagher, the consolidation of large healthcare organizations being consolidated. They're looking to buy and merge with smaller organizations. We are certainly seeing that. We're seeing they're doing it obviously for efficiencies and economies of scale, but also there is a huge push towards virtual AI type of healthcare. So that is something that you're going to continue to see. And, how we will be responding to that, how workforce will be responding to that, it was really kind of, wait to see, right? If you've used telehealth or you've used virtual medical care, then you kind of understand what I say. There's certain limitations to that. But I would say that we're going to continue to see those collaborations and consolidations, at least for the next 5-10 years, as we continue to work and strive to attract and retain the current workforce that we have. I think you're going to continue to see challenges around that. I would also add that because we're shifting to a more virtual type of feel to healthcare in certain elements, then it's even more critical and more important that those of us who do have access to doctors or to physicians that you can access and have a relationship with, that's going to be, one of those things that will be, high on everyone's priority list to at least get a doctor so that they can see one. And, a personal story, we have tried to get an appointment for a primary care physician just to have a preventive care. You're looking at least 6 months. So that's going to continue. So the best thing that I would share with you is when it comes to technology, and those consolidations, that's going to continue.
Anybody else want to chime in on that?
Rosemary, with regards to the corporatization of healthcare, there are a lot of major healthcare players out in the market, and they are gobbling up the smaller. They're purchasing physician practices. They are opening new hospitals and making them part of the bigger networks. There are both pros and cons with the corporatization of healthcare, in that the larger entities can support and sustain the major expenses that are involved with healthcare. There's a lot of we know equipment and the supplies and everything that's needed to support the industry is sometimes insurmountable for some of the smaller practices and standalones. So larger corporations can offer a little bit more stability on a long-term basis. Some of the healthcare, the industries that I've been in, the companies that I've worked with that are corporate have offered tremendous long-term retirement plans. So there's increased benefits to staying with the same company structure, that has consistency over time. So, if those major corporations are able to be competitive by offering things that are more sustainable and reliable in a more, variable employment market, I think there's something to be said that's very positive about the corporatization of things. During the pandemic, a lot of businesses and industries closed, and that included healthcare industries and healthcare, smaller healthcare companies. They just couldn't afford to stay open with, the demands. So there are good things that are coming out with the corporatization of healthcare. However, like any free enterprise situation, when you have more of the big guys gobbling up the small companies, you create less competition and there's more standardization in terms of what you have to do to compete for the same labor pool. And that means that you have to work harder to make your corporate entity unique in terms of its culture and the way that it treats its employees. So I don't think that's going to go. I don't think the corporatization of healthcare is going to go away. I quite frankly, I think it's going to be pretty strong and steady. I love when I see some of the standalone healthcare entities, and I can think of one in particular in Northern Palm Beach County that's notable. That's an amazing healthcare location, an entity, and they do quite well based on their reputation. And they've never succumbed to becoming part of any of the standard healthcare entities, and they've done so through their reputation. But I don't know. I don't see that going away, Rosemary. I think that we're going to be faced with that for quite some time.
Thank you. How about you, John? Did you have anything you want to add to that?
I have a lot that I want to add to that. At the end of the day, I am not a huge fan of corporatization of America. You have a crisis in Palm Beach County and around the nation for first-time home buyers because housing market has been driven to the roof because because corporations are buying homes to rent as VRBOs. You have economy of scale where Baptist all of a sudden buys let's not choose any local companies, where a large organization acquires a secondary organization, but sorry, we already have a sales manager, so we don't need you. And your billing department, we don't need the billing department because now we're going to have it over here. So when you have an organization that is focused on finance and making money, they are going to do that. Yes, I can buy the $1 million MRI machine, but my MRI techs now, I'm not going to do anything to support those MRI techs. If we are going to go ahead and start to do remote working, well, you can find an administrative assistant in the Philippines at half the prices you can find one here in Palm Beach County. So you're going to have companies striving for their bottom line over necessarily the services that are being provided. If you want to look at that closer, take a look at the senior communities in our area that are being bought up by a dozen companies nationwide. Is the care that is being provided to our seniors actually increasing? Well, there's a new rug. there's new chairs. The paint is awful pretty, but we're still having the staffing issues. We're still having all of these other issues. So I would like to see the same scenario that happened in the late 90s, where you had companies that were buying up these doctors' offices, PHP, and I could name probably five or six others if I get my brain a minute, that they were buying the doctors' offices, and they were buying the doctors' offices because economy of scale, we're going to make it easier. Come 2006, 2007, the doctors are like, I don't want to be an employee. And they all started pulling away from those organizations. And you went back to those independent physicians. So I don't think the corporatization of America on healthcare or globally is going to really add a benefit to anyone except the shareholders and the board members for those corporations.
Well, John, I could count on you. I can count on you to tell it like it is. And, I'll just say, as a consumer of healthcare services and a 30-year resident of Palm Beach County, I look around and I see these things. I see that my primary care doctor, and I have excellent health insurance. Just called me, their staff called me today, and they wanted to make my regular exam scheduled for next February. I said, next February? I haven't even had the one in August yet. I also, very prudently, 22 years ago, bought a long-term care policy for my old age. And that would cover the cost of any assisted living facility here in Palm Beach County. But I've looked at that situation, and I am well aware of the staffing issues and problems with those communities, continuing care communities and assisted living communities and so forth. So I'm out here as a consumer wondering, well, okay, I have a plan to pay for something, but what will I be getting? You know, I mean, maybe I'd be better off staying home with home health care rather than going to a facility that is understaffed and it's always changing. So, you know, I'm just saying, as a consumer, we're sitting out here looking at all this and trying to be responsible about taking care of ourselves. And so I appreciate your comments, John.
Yeah, it's scary.
It's confusing at the very least for a lot of us. As Katie said, we're in a period of change, but then I've lived 84 years, and as far as I'm concerned, it's always a period of change. There's always chaos, and everybody has to kind of figure their way through it all. But I tend to be a person who wants to help focus on those things that can be done to improve our delivery of services. So we all know that a lot of healthcare workers resigned during the pandemic and suffered. Many lost their lives, actually. And so today, having gotten through this, what are healthcare organizations doing to support and enhance staff resilience? Not only with regard to disease, but with the pressure to perform with lower staff and, you know, all that. So who would like to speak to that first?
I'll say a few words about the resiliency and dedication of healthcare workers as a whole. Healthcare workers are care providers, and they oftentimes forfeit their own well-being in order to take care of others. And that's been a historical issue. You know, they put their needs to the side in order to take care of their patients. So being aware of healthcare burnout and healthcare fatigue is really critical. And I don't really think that it was given as much attention until the pandemic. You know, we had offered a presentation called, you know, what's great about the Great Resignation and the pandemic. And we talked about flexible workplace options with one of my, the HR Association's presentations. But another one of the benefits of the pandemic has really been talking about mental health and about the criticality of taking care of our own needs. And, you know, the whole concept of putting your own mask on first to breathe before you take care of others being so important. And so, Rosemary, when you're talking about the resignation of front care caregivers, you know, that made the shortage even worse, because suddenly those people whose needs were not being met and were forfeiting their own well-being are no longer willing to do that. So what I'm seeing, there is more of an emphasis in, for no other reason other than you need to have the clinicians to be able to take care of the nurses. You have to come up with different staffing options, different compensation structures. I'm returning, as I mentioned, to the healthcare hospital world, and the salaries right now that I'm looking at for the registry pays and the frontline nurses, and even the bonuses, $15,000, $20,000 bonuses to sign on to become a full-time nurse, blow my mind. I mean, we've always wanted to do things to be competitive, but boy, it's really brutal. And although I fully recognize and understand the concept of for-profit healthcare, you know, that they're lining their pockets, you know, the shareholders are lining their pockets with the profits. At the end of the day, a lot of money is being spent on being able to just staff the healthcare
Absolutely.
Organizations. So, you know, thank goodness, what I'm seeing, people are getting paid more appropriate wages to just work their core hours. Back in my baby boomer generation, who was more than willing to work 4 or 5 12-hour shifts, a 48 or 60-hour work week was nothing. I mean, I actually, I don't remember ever working less than a 60-hour work week. That just seems normal to me. Now, if you talk to the younger generation, they're more than happy to stop at the 3 days, 3 12-hour shifts. So you just have to have more competitive wages for them to be able to earn, a living wage, and to be able to afford the house, that John was talking about, that is more difficult to afford these days. One point in favor of the mature worker, I will say, speaking of the affordable housing challenges, which, John, you recall, we faced those in the early 2000s when the first housing boom really was an issue. The mature worker typically doesn't have housing issues. I mean, at this point, that typically they're a little bit more stable and secure in terms of where they choose to live and what their life choices are. And for that reason, don't have the same transient or need to move compelling issues that the younger workforce, are having to face. So I will leave it at that. I don't know if I answered your question. I had lots in there, but I'll leave it there.
Yeah.
Well, I find myself wondering, all those people, healthcare workers that resigned during the pandemic, has there been a systematic approach by employers to get them to come back?
Yes, re-engage the boomerang generation. Yeah, absolutely. Absolutely. I was just talking that with a colleague here at my new job about what are we doing to reconsider individuals and reach out to formerly employed individuals and even retired individuals who've retired that we're contacting again.
Does anybody have any other thoughts about what employers can do to re-engage and excite candidates and current staff?
What we have to focus on right now to re-engage the after boomer generation, the younger generation, is that we have to show them the why. We have to show them why what they're doing makes a difference in the lives of the senior. We have to show them the why they're making a difference. We have to show them that our organizations believe in them and make a transition from the dictator type leadership to more of a servant leadership, where the leadership is helping grow the younger generations. In regards to what Katie was saying about the more senior worker, yes, they don't have transportation issues, they don't have family issues, they don't have housing issues. So we have to reinvigorate that side as well, and the understanding that these individuals are vital. My mom, God bless her, she's 84 years old. She's actually in her dog kennel today up in Massachusetts, working the front of the house like she's been doing for the last 60 years, right? We see an older and older population needing something to do. A body in motion stays in motion, right? And we went through where seniors, life expectancy was in the 70s, late 60s, early 70s. Now we're in the 80s, 90s. So there's a lot of opportunity to re-engage those folks, maybe not to a 12-hour shift, but they could certainly work a front desk at a doctor's office. They could certainly do billing. They could certainly do medical assisting. They could certainly do nursing. They could certainly work over in a skilled nursing facility or an independent living or an assisted living facility. So it's really leadership, going from a dictator leader to A, B, and C, or you're fired, to, hey, I need you to get this done. How do you want to get it done? Type style of leadership. I think that's where we can make a change. That's how we reinvigorate these folks. If you're looking at the Gen Z, show them what their career path is. How are we going to get there? Well, I want to be a nurse. Well, you're a medical assistant now. You know what? If you stay with me a year, let me help you get the education you need to become an RN, and then you could be an RN here in my office. So how do we keep them in there? That's really the key.
John, That is, I think, where I'd like to leave it right now, because I personally believe that's the missing piece, leadership on a broader level. Okay, so if anybody has a question of our panelists, take yourself off mute, raise your hand, and Christine will call on you. No questions?
I have a question.
Yes.
I'm interested to hear what Tamara was going to say before she was so polite to let me go first.
Yes. Thank you.
Well, John, I would just say that we have to go back to looking at that, critical evaluation, changing that traditional mindset about how we think about a workforce. It's not about all these young, Gen Zs coming in and taking over the workforce. Many of us know we're going to be working long before, long after 65 rolls around, right? Because we have a shrinking workforce, we have a shrinking population. We do not have the people entering the workforce that we did 40, 50 years ago. And, if you just look at the financial piece of it, people, what did they say, Katie? The last retirement presentation we had was shocking. There were 60% of the people in the workforce today that are pre-retiree have less than $30,000 to retire on. So that means we're going to be working for a much longer time than we thought we were, and because the workforce needs us. So you're going to have folks that are looking for staff, people like yourself, that are reaching out to, those more mature workers, and they're going to enlist them to help, because it's either organizations either do or die, because they either, reevaluate, take a critical new direction on how they're imagining their workforce and how to get the job done, or they're not going to be able to get the outcomes or the results that they're looking for.
Okay, well, I don't see any hands raised, so let me just throw out an idea here. I'm focused mostly on Palm Beach County. Yes, the United States, Korea, Japan, they all have their problems. But what can we do here in a practical fashion in Palm Beach County to meet our staffing needs? We all know that our immigration system has broken down. I don't want to get bogged down in that debate, but there are good people in other countries that could bring their skills here. But could we close some of the gaps if proper training, retraining, and retaining of employees that are already working, keep them from retiring with incentives of all kinds, pre-retirement coaching programs. When I retired, when I was with Ameriprise Financial as a financial advisor, I approached a number of companies about pre-retirement coaching. They were only interested in helping people save and invest for retirement, not talking about how will I live for 30 years after I leave this job. What do I want as a human being and purpose in my life? What's new would I like to do? So I think there needs to be a growth in those kinds of programs. I said that 10 years ago. I'll say it again today. And that will help perhaps keep some employees that might have retired. Of course, we live in Florida, and I know you said there's competition income-wise, but Florida historically has been a low-wage right-to-work state. And for some of the lower-level healthcare workers, perhaps we need to have an increase in incomes levels, because this has become an expensive county to live in. The other thing is, and this is what I would like to throw out as an idea, could or should there be a county-wide task force, develop a strategy with critical partners to solve the problem in industry, workforce development, education, and so forth, with incentives to the education and private sectors and changes in tax laws to pay for these incentives? Is there a leadership for this?
In Palm Beach County, yes. In Martin County, probably not. So I think that we would, if we were able to do something locally and truly look at the issues that we have in place, try to find ways for the lower level income workers in our healthcare industry can find reasonable housing, then yes, I think we could actually do it. So long as blocks and tackles weren't coming from outside of our county. But I don't know that is possible at this immediate point. Being honest.
Where would you see leadership coming from?
Well, leadership is coming from Tallahassee. Tallahassee now, they've taken away the local rules. So the local county commissioners don't have the ability to determine what's really best for their counties anymore, and they could be overruled at any time by Tallahassee. Right?
So leadership perhaps not in the government sector? Outside
outside of the government sector would be good, but if we have to find affordable housing to keep our CNAs here, right? That's really the key. A new home sale in Palm Beach County is well over $400,000, $500,000, but the incomes are still where they were in 2001 when we had our old housing crisis, when homes were $100,000. So we have to find a way to do that. Now, I'm a small business, and it's very, very hard for me because each dollar I pay to my lower staff is a dollar less that I get paid, and I'm not Mark Zuckerberg. I'm just a regular guy trying to make a nickel, right? Just a honest Irishman working hard to make a living, right? Is where I am.
Christine, do we have any questions? I want to make sure we get them in.
We do have one. Gail asks, how does magnet status help or hinder the challenges of hiring and retaining? The housing costs in Palm Beach County also hinder supplemental staffing. Travel agencies often provide housing stipends or apartments, and now that the costs are so high, it drives down wages. It makes it difficult for travel nurses to duplicate expenses.
They saying it's difficult to have travel nurses come to this area. Is that it?
Gail, do you want to open your mic and respond?
I'm asking certain questions because I actually came from this space. I'm now in higher ed, but I came from the healthcare staffing space. I was there for 20 some odd years. And one thing I found with the magnet status is when I had 2-year nurses, there were times that I couldn't place them in some facilities who were working on getting a magnet status because of the BSN requirement. And I just wondered, does that help or does that hurt in retaining and hiring? And then the housing cost is something completely different because in the travel market, you have nurses who they come from other states and they own a home or an apartment or something that they're keeping up and they're paying rent, mortgage, whatever. And they would come down here and either take a stipend or something like that. And they're duplicating expenses. But now that those costs are so high, more travel agencies aren't really saying, hey, we'll get you a free private apartment. We're going to give you a stipend instead, but it's still not covering that.
Right.
So these are the things, aren't they, that could be addressed in some way by someone?
Yeah, because I really think that the supplemental staffing is going to make that challenge is just going to add fuel to that fire of already having these challenges.
Anything else that anybody would like to add at this time?
Regarding magnet status and kind of the BSN requirements. Just an observation, where you have healthcare entities that are primarily RN driven, not LPN driven, they require the BSN status. You typically have better outcomes, and better outcomes then create better quality measures, and better quality measures then results in better reimbursements in healthcare. So, that there is a cycle, that at the core of it is basically healthcare staffing. So the question is, how long are you willing to invest in those higher cost nurses, the higher quality nurses, to be able to get those outcomes. And that's not necessarily the focus of today's conversation, but it is a focus of healthcare employers who want to invest in their staff, in the development of their staff, and are they willing to pay for the re-education to retain them and make them, want to stay there. So that's my only real comment regarding the magnet status. With regards to staffing agencies and traveler nurses, I worked with a healthcare entity that had traveler in-house registries and traveler programs where they would place nurses all over the United States. And Florida is actually quite appealing. People want to come here. And for years, we didn't have reciprocity for licensure because the state of Florida did not want to allow the ease of clinicians moving here because people would come here and would move here because it was easy to become a nurse. That thinking has changed. So some of that has to do with what goes on in Tallahassee, to John's point. You have to rethink, as a state, we have to rethink the way that we would provide the provision of, the people who are licensed and credentialed to do the jobs. So I think that we're able to attract nurses to come here. The fact that we have no state income tax, for example, makes it very appealing. And that kind of is a counter to some of that's the reason why our wages are probably not as high, because the affordability to live, other than the housing market, the affordability to live is a little bit more appropriate or economical in Florida than in other parts of the nation. So it's a balancing act. All of it.
Yeah. What I believe you're going to start to see is you'll see the larger corporations and larger employers also, as part of their benefit package, offering housing. If you look at the travel industry, they're bringing people in from Europe to be their waiters, waitresses, and groundskeepers, and they offer them housing.
Yeah, providing like an employer hostel, if you will. And there's challenges with that as well, right? The other thing that we didn't talk about, Rosemary, is just the exodus of nurses not treating anymore. They're not treating patients. They're not seeing patients. They've exited healthcare somewhat altogether, or maybe working in a fringe area of healthcare like health insurance or actuarial, studies, or even informatics. So there's also that we have to think about, just the expanding role of healthcare.
Right.
I want to thank everybody. I want to recognize your time. This is a conversation that there are so many parts to it that we could continue talking about, and I appreciate everybody's contribution. I'd like to see more conversation about all this, and I think I'll just say that my orientation to problems goes back to I initially started my career in city planning and working with citizens organizations, hospitals, businesses, and so forth, to develop a plan of development for a community, hitting on all the areas: education, healthcare, recreation, and so forth, and getting all the ideas out there, and then working with the political systems, the decision makers, to bring some things into fruition, some of which happened, some of which didn't. That was back in 1969. Oh, God help me. It seems to me, and maybe because of my background, I would love to see a task force created by whomever has authority, power, influence, whatever, to tackle the issue, bringing the parties together. I see everything as being very fragmented, people focused on their businesses, their careers, whatever, but nobody really pulling together the experts, the decision makers, and saying, okay, what can we do and how can we go about making it happen? Not all problems be solved, but at least some. Do you think there's a space and a willingness somewhere to do that?
Yeah.
Yeah, if you can't get healthcare, you've got to look at other alternatives. You've got to look at alternatives, right?
Well, let's leave it at that. I welcome your ideas about who could provide the leadership in that, because otherwise we're just going to go on as we are, everybody dealing with their own problems and challenges. So I want to thank everybody who participated, our panelists, and everybody who attended. And just to remind you that everybody will receive a YouTube video, a document created by the Encore Network on age-friendly employers, and stay tuned to our other programs coming up. Every month we have something. Christine, are you waving at me or are you ready to sign off?
We are ready to sign off. Thank you all for joining us, and have a great Wednesday. Thank you so much.